Hello, today I shall talk on pericardial disease. The disease of the pericardium is called pericardial disease, and covering of the heart is called pericardium. There are three entities of pericardial disease. Number one, pericarditis, then pericardial effusion and cardiac tamponade. So these are the three clinical entity of pericardial disease. Being a student of clinical medicine, every student should have clear concept about these three disease of the pericardium of the heart. Now, inflammation of pericardium is called pericarditis. Definition: collection of fluid, abnormal collection of fluid, of course, in the pericardial cavity is called pericardial effusion. And what is cardiac tamponade? Cardiac tamponade is a sequelae of pericardial effusion when there is a large accumulation of fluid, that is large pericardial effusion which causes heart failure. Then the condition is called cardiac tamponade. যদি আমি বইয়ের ভাষায় বলি তাহলে এভাবে বলতে হবে যে acute heart failure due to compression of the heart as a result of large or huge pericardial effusion. So pericardial effusion when become very large, and the large pericardial effusion when compress the heart, then the clinical condition scenario is called cardiac tamponade. Now come to the symptom. In case of pericarditis, the patient may present to you with fever. This fever may be high grade or low grade, short term or long term, depending on the cause of the pericarditis, and patient may have no fever. The next important symptom in pericarditis may be chest pain. So most commonly these two features with which the patient may present to you. Then pericardial effusion. In case of pericardial effusion, patient may have fever or may not have fever, and patient may complain of chest pain, dull, compressive type of chest pain patient may have. So fever plus minus, chest pain plus minus. With these, patient may have shortness of breath. That means dyspnea, P silent, dyspnea. Okay. Patient may have features of right heart failure. Now, what are the features of right heart failure? Patient may have raised JVP, raised jugular venous pressure, right heart failure feature, JVP at first. Then patient may have tender hepatomegaly. Patient may have mild or moderate or even severe ascites. Patient may have leg edema. So these are the features of right heart failure. So patient may present to you with the features of right heart failure like this. Now, in case of cardiac tamponade, what will be the presenting symptom to you? Patient may present with, in case of cardiac tamponade, patient may present to you with features of hypotension or shock, like features of hypotension or shock. like drowsiness, physical weakness, vertigo, oliguria, or unconsciousness. So these are the presenting symptoms in case of cardiac tamponade. Now on examination. At first, the very simple examination with what usually we proceed, pulse, examination of pulse. In case of pericarditis, the pulse become rapid, that is tachycardia. In case of pericardial effusion, pulse also tachycardia, but pulse become low volume pulse. So very important examination finding in case of pericardial effusion. What is that? In case of pericardial effusion, the pulse become tachycardic and low volume, and in case of pericarditis, pulse only high. Okay. Now in case of cardiac tamponade, pulse has a special character, that is called, in case of cardiac tamponade, the pulse also tachycardic, high and low volume, but there is a special character which is called Pulsus Paradoxus. As you know, Pulsus Paradoxus. Pulsus Paradoxus. What do you mean by Pulsus Paradoxus? Every clinical student should have clear conception about the Pulsus Paradoxus. At first, a normalcy. Normally কি হয়? In physiological condition, during inspiration, I talk here again, Pulsus Paradoxus. Physiology, during inspiration, blood pressure, systemic blood pressure, mostly systolic blood pressure fall and pulse become high. Physiologically, during inspiration, systolic blood pressure fall and pulse rate become higher, and the fall of the systolic blood pressure during inspiration should be less than 10 millimeter of mercury. If the fall of systolic blood pressure during inspiration become more than 10 millimeter of mercury, then the condition is called Pulsus Paradoxus. So during inspiration, if systolic blood pressure fall more than 10 millimeter of mercury in comparison to that during expiration, then this is called Pulsus Paradoxus. What do you mean by this paradoxus? The paradox here is, while you listen the heart sound with your stethoscope over the pericardium during inspiration, you might lose some pulse over the peripheral, over the limb, like radial pulse. I repeat again, the Pulsus Paradoxus, the paradox is here, when you listen the heart rate over the pericardium, you may not feel the pulse over the radius. This is due to fall of systolic blood pressure during inspiration. Okay, so in case of cardiac tamponade, there may be pulsus paradoxus. Okay, though this is a parameter of pulsus paradoxus, pulse, but this pulsus paradoxus should be measured by blood pressure, by measuring blood pressure, not by feeling the pulse, though it is called pulsus paradoxus. So it is another paradox. It is another paradox, as because though it is pulsus paradoxus, the name is pulsus paradoxus, but this is measured by systolic blood pressure during inspiration, not by palpating or feeling the pulse. Okay, now jugular venous pressure. During pericarditis, jugular venous pressure may be normal. During a pericardial effusion, jugular venous pressure found high or raised. Cardiac tamponade, in case of cardiac tamponade, GVP also raised, but another term here used, Kussmaul, Kussmaul, Kussmaul's sign. Kussmaul sign. The Kussmaul sign is found in case of cardiac tamponade, not in pericardial effusion or pericarditis. Again, come here, Kussmaul sign. What is Kussmaul sign? Kuss, Kussmaul sign. Normally during inspiration, JVP fall, and during expiration JVP rises substantially within normal limit. I repeat again, in physiological condition, during inspiration JVP fall, and during expiration JVP rises. Why? During inspiration, the flow of blood through the right heart increases, so JVP fall. But in case of cardiac tamponade, when the heart becomes compressed by the fluid accumulated surround the heart, during inspiration blood cannot flow in increased volume. So in case of cardiac tamponade, during inspiration JVP increases paradoxically, rather being decreased. I repeat again, in case of cardiac tamponade, during inspiration JVP raised. So come here, JVP in case of cardiac tamponade, JVP increased during inspiration, and this increase in JVP during inspiration is called Kussmaul sign. Kussmaul sign. This name is after scientist Mr. Kussmaul. Okay, now come to blood pressure. Blood pressure in case of pericarditis remain quite normal. In case of pericardial effusion, the systolic blood pressure may fall a little bit. In case of cardiac tamponade, again the term is called pulsus paradoxus. Pulsus paradoxus. I said again, during inspiration systolic blood pressure fall more than 10 mm of mercury in case of cardiac tamponade. If pressure is recordable, but sometimes patient may present with the feature of shock, so BP may be not recordable. Okay, I think okay. Now again, pericarditis, pericardial effusion and cardiac tamponade. Okay, examination of the pericardium. Pericardium. During examination of the pericardium, in case of pericarditis, you may find rub, pericardial rub, a friction rub in case of pericarditis. During in case of pericardial effusion, there will be no rub. Rather, two very important signs you may find out. Number one, muffling of heart sound. That means the intensity of the heart sound, especially first heart sound and second heart sound, will be very decreased, and it will be very difficult to hear or listen the heart sound. So this is called muffling of the heart sound, number one. And number two, the area of cardiac dullness will be increased. Area of cardiac dullness will be increased. So these two features you will find in case of pericardial effusion as well as in case of cardiac tamponade. In case of cardiac tamponade, you will find the muffling of heart sound also, area of cardiac dullness increase area of cardiac dullness. And beside these two features, in case of cardiac tamponade, you may find out another important sign, very difficult and very rare. Usually we miss this finding, which is called aort, EWART, aort sign. Okay, what is aort sign? Aort sign is due to collapse of left lower lobe. Left lower lobe collapse in cardiac tamponade is called aort sign. What will be the features of the aort sign? Though it is a collapse, but there is patent bronchus. So in aort sign you will find percussion note dull. On auscultation you may find out bronchial breath sound. Why bronchial breath sound in case of collapse? Though we know in case of collapse everything collapse, that means every sign will be negative. There will be percussion note will be dull, breath sound will be absent. But here percussion note is dull, but breath sound present, and that is bronchial in breath sound. Because though it is a collapse of the lung, but there is patent bronchus. So it is called collapse with patent bronchus, and in this case you will find out the dull percussion note with bronchial breath sound just below the tip of the scapula on the left side. Okay, so next, these are the investigation. Now come to the another modality, investigation. At first, ECG. In case of pericarditis, the ECG features will be tachycardia and ST elevation with concavity upward. Very important. Tachycardia and ST elevation with concavity upwards. ST elevation with concavity upwards. Usually we miss these, sometimes misdiagnose this ST elevation with concavity upwards as it may be a case of acute myocardial infarction. How? In case of MI, there will be pathological cue, ST elevation, convexity upwards, and terminal T wave inversion. This is the MI, myocardial infarction. Okay, acute myocardial infarction, of course. But in case of pericarditis, the ECG feature will be, there will be no Q, of course, no Q, or the Q within the normal physiological limit. The ST elevation, of course, but the concavity will be like this, like this. So look at here, tachycardia with ST elevation, of course, this is the baseline, this is the ST elevation with concavity upwards, that is called saddle, SADDL, saddle shape. Saddle. If you confuse in your Viva board concavity or convexity, then just go for the word saddle shape, the saddle shape ST elevation in case of pericarditis. Okay, now come in case of pericardial effusion. In pericardial effusion, the ECG finding will be, of course, tachycardia, but the ECG volume, ECG lead will be low volume. So in case of pericardial effusion, the ECG finding will be tachycardia with low volume ECG, low volume tachycardia. Very important differential diagnosis here. If the ECG finding is tachycardia, okay, with high volume, then what will be the diagnosis? The diagnosis will be thyrotoxicosis. So here in case of pericardial effusion, the ECG finding will be tachycardia. In case of thyrotoxicosis, ECG finding will be tachycardia. But in case of pericardial effusion, there will be low volume ECG. And in case of thyrotoxicosis, the ECG will be high volume. Okay. Again, if the ECG heart rate become low, that is